I would like to greet the chairperson and CEO of CANSA, Mrs. Sue van Rensbeck, who I work very closely with since last year, Professor Freeman from the Department of Health, civil society, government officials that may be present here this morning, researchers, scientists, service providers, and advocates against breast and cervical cancer. I am proud to be associated with the Women's Health Conference, and maybe to give you a bit of background of why I got attracted to dealing with the women's health issues, as Professor Freeman has posed this question. And one may ask, because I've got a financial background, not a medical background, why is it that you're so interested in health issues? The way I see things is that the economy of our country, the women of our country, they play a very important role in the growing economy of this country. So they've got to be healthy in order to be productive and for the economy of this country to grow. So that is really why I chose this as one of my area of focus and being involved in the programs around the women's health. So I'm sure that explains it, Professor Freeman. I really would like to thank CANSA for allowing me the privilege to share my thoughts with you as an advocate against breast and cervical cancer. And while this platform allows me the opportunity to add my voice to celebrating women's health, I would be failing in my duty as a woman, a mother, and a first lady if I didn't express my concern about the status of women's health in our country. In the same context, I would be irresponsible if I didn't reassure you of my willingness to work with all stakeholders to advocate for the optimal health of all women in our country, through my foundation, of course, called TMZ Foundation. So if you want to visit it, you can, the website link is www.tmzfoundation.org. In achieving their optimal health, our women continue to be challenged by many factors, including poverty, poor access to basic services, low levels of literacy, and gender discrimination. On a daily basis, women are placed in the invidious position of having to make choices which prioritize the needs of children and family over and above their own. Hence, while women are vulnerable to infectious and non-infectious disease, both personal circumstances as well as an apparent poor health service response result in women suffering premature death or ongoing pain and suffering which we cannot accept. I have no doubt that many scientists at this prestigious event have already offered evidence on the prevalence of cancers among women. We are aware that more than half of the women aged 15 years and older who are at risk of developing cervical cancer will die, definitely. In a country which experiences HIV and AIDS within pandemic proportions, it is critical that we acknowledge that while 15.5% of women in the general population are estimated to harbor cervical HPV, 63% of invasive cancers are attributable to HPVs. We are also aware that breast cancer is the second most prevalent cancer in our country. Therefore, I have no doubt that all the advocates in the room will concur with the question, why are women suffering and dying painful deaths from cancers which can be prevented if risk factors are known, especially the use of tobacco and its products? Why are cancers not being detected early? And more importantly, why are our girls why are our girls not receiving vaccines pre-sexual stage, which can prevent the onset of the cervical cancer in the first place? Are we correct, therefore, to infer that girls and women are continuing to engage in risky behavior, that they seek health care at very late stages in the development of the cancer, or the health service is not responsive to their concerns to facilitate early detection or to provide necessary treatment and support? And finally, are we not providing vaccines, not due to the lack of political commitment, but rather that the cost of vaccines render them completely unaffordable to the country which is not poor enough to benefit from Gavi support, but also not rich enough to pay 2,000 for the desired, 2,000 rand for the desired dose per girl? In our attempt to seek solutions to the very complex questions, it is agreed that this crisis facing the women in our country cannot be addressed and solved by any one sector. Our risk factors alone, particularly the use of tobacco and tobacco products, will tell us that stakeholders from government, the private sector, research and academia, civil society, as well as advocates, must commit to a common agenda. As an advocate myself, I agree that our roles and functions in this battle will vary. However, we must, with mutual trust and respect, strive towards an agreed outcome. However, in our combined effort to create awareness of risk factors, let us not forget to respect matters of culture and language, and let us not persecute women for being responsible for their disease. Women at present don't necessarily have a platform to talk about the functioning of their bodies, about where to seek help and how to approach their partners and families about their fears of a positive diagnosis. Communities alone cannot be held responsible to create support structures for women. All of us collectively have a role to play. As an advocate against breast and cervical cancer, in the country, I have a duty to be familiar with the work of institutions of civil society, including CANSA, as well as government, and to engage and support all initiatives which enhance the quality of the lives of women. However, as the First Lady and the present chairperson of the African First Ladies Against Breast and Cervical Cancer, I have the opportunity to advocate for the cause at a very high level. At the recent 4th Cervical Cancer Conference held in Ghana, Accra, the African First Ladies committed to working closely with our heads of state, ministries of health, UN missions, and civil society leaders about the burden of women's cancers and other non-communicable diseases in our own countries, and to work for improved financing and leadership for the prevention of women's cancers worldwide. We also pledged to mobilize our diplomatic and public health leadership to ensure women's cancers feature prominently this September at the United Nations General Assembly Development Summit, on the MDGs and the United Nations High-Level Summit on NCDs, scheduled for September 2011. To achieve this, we pledge to work with our governments to strongly urge the UN General Assembly, UN Secretary General, the African Union, UNFPA, World Health Organization, the World Bank, UNICEF, and UNAIDS, and heads of our national parliaments prioritize improved cervical and breast cancer prevention and treatment. And we hope that these efforts will complement initiatives by civil society leaders and other governments to see that the international community aligns its resources and attention to the health needs of our time. Perhaps our greatest immediate need is to join hands with all stakeholders to engage Gavi on making vaccines affordable to all African countries to benefit all girls. In conclusion, I congratulate CANSA on their sterling work and for hosting Women's Health Conference, thereby creating a platform which can only lead to enhancing the quality of lives of all women in this country. Thank you for allowing me to participate in this significant event.